Hello everyone, welcome to my channel. Today we'll be talking about periodontal disease. So from today there will be a series of classes in periodontics where I'll start first with diagnosis, then etiology, then pathogenesis, treatment planning, prognosis, therapy, and finally prevention and maintenance. So what is exactly periodontal disease? Here in the picture you can see a healthy tooth, and here you can see periodontal disease in the tooth where there is deepening of the pocket, and you can see bleeding on probing, there's inflammation, there's plaque accumulation and calculus. So periodontal disease is nothing but a group of inflammatory conditions that affect the supporting structures of the teeth or periodontium. Okay. So first, in the right side, you can see healthy tooth, then gingivitis. In gingivitis, you do not see periodontal PDL ligament. You would not see any destruction. You would not observe any bone destruction also. But whereas in periodontitis, you will observe. Now coming to the next slide. Here, we are going to see some of the important terms that we need to keep in mind. And first thing is in this picture here, just let me highlight it. Here you can see few of the important terms. This is gingival margin, here this is pregingival groove, and here there is mucogingival junction. This is cementum, this is PDL and alveolar bone. Okay, and here the gingival sulcus is present. Okay, so most of the perio measurements are taken from free gingiva. Okay, shallow linear depression that demarcates free gingiva from the attached gingiva is nothing but attached gingiva. Now here you see mucogingival junction. It is the junction between attached gingiva and alveolar mucosa. So free gingiva is keratinized, but it is not bound down. Attached gingiva is keratinized and bound down. Mucogingival junction is not keratinized and not bound down. Okay. So free gingiva is, so let me just write it down. Free gingiva. Basically here it means gingiva is free. Attached gingiva. And you see here mucogingival junction. So in the free gingiva, you can see that it is keratinized, but it is not bound down. Here it is keratinized and bound down. Here it is not keratinized and not bound down. Okay, so what happens exactly? As long as you brush your teeth and maintain good oral hygiene, tooth remains healthy. But when you consume foods that is rich in sugar and your oral hygiene is not good, what happens exactly? Why do people say sugar is harmful? So what happens is whenever you consume food that's rich in sugar, there'll be formation of lactic acid. Okay, and this is harmful. But our tooth has its own self-defense mechanism. That is, one is by using fluoride supplements in toothpaste or gummies or in water. What happens is, we know that carboxy, whenever we add fluoride, our tooth is very strong because there is fluorapatite crystals. Okay, let me try to show you a diagram. Just give me 1 second. And okay, so I'm unable to find, I'll just draw it here. So first thing is calcium is present in the tooth, phosphorus is present in the tooth. Okay. But whenever you add fluoride in, that's why it's very important that the water has fluoride content so that it prevents caries. Okay. So whenever there is more amount of fluoride in water, it can lead to fluorosis also. So we have to keep in mind how much we are adding. So whenever we add fluoride, there is formation of fluorapatite, and which is very much stronger than the regular hydroxyapatite. Okay, so this is one way, and another way is saliva. Saliva makes sure, so whenever there is less saliva, the condition is xerostomia. Even in this condition, there will be a lot of caries. Okay, so saliva basically acts as buffer. So whenever we consume high sugar foods or drinks like Coca-Cola, the tooth is more prone to get disease. So first step is there'll be bacterial accumulation. So bacterial accumulation can be seen, which will then progress. Okay, so microbial plaque is generally considered as the initiating factor. So first there'll be bacterial accumulation. First, what will happen is there'll be gram-positive bacteria that will infect the tooth, and this bacteria is aerobic. It means it can only survive in oxygen-rich environment. As you go deeper, if the tooth if the tooth is infected by this bacteria, and the gram-positive cocci is usually located in supragingival region. When it goes deeper and you go around subgingival region and you still see, like, there is bacterial accumulation, the bacteria that is present over there is gram-negative rods. Okay, so it will affect gingiva. So first, what happens exactly is, here you can see healthy tooth, that is oral hygiene is maintained, maybe the water, there is fluoridation done, and oral hygiene is maintained, so the tooth is healthy. Gingivitis, what happens is, here PDL ligaments are not affected, alveolar bone is intact. Okay, so this is normal. But there is inflammation in the gingiva. Okay. Here you can see itis means inflammation, so gingival inflammation can be seen. Periodontitis means PDL is loosened, there is inflammation, alveolar bone is also not intact, and there is inflammation even in the gingiva. Okay. So normal periodontal health means there's no inflammation, no PDL destruction, and no bone destruction. Gingivitis means there is inflammation, no PDL destruction, and no bone destruction. Okay. Periodontitis means there is inflammation, PDL, and bone destruction is present. So what did we understand by this is, microbial plaque is considered to be initiator of the disease process because it serves as a challenge to the host and host tissues. How the host responds to the plaque challenge determines the severity and extent of the tissue damage associated with that response. So if there's a lot of bacteria and we are maintaining good oral hygiene, you see a dentist regularly, then in this host, maybe we will be able to fight it back, because gingivitis is reversible. Periodontitis is not reversible. But if the host is not taking proper care, the gingivitis might progress to periodontitis. Okay, so this is the review. So let's have a quick review of today's class. So most important thing is free gingiva is keratinized, not bound down. Attached gingiva is keratinized and bound down. Mucogingival junction is not keratinized and not bound down. Okay. Now we know that plaque is the first initiating factor. I told you, like whenever fluoride is included in the toothpaste or water or supplements, fluoraptide crystals are way more, they protect the tooth than the normal hydroxyaptide crystals, and even saliva acts as a buffer. Okay, so whenever there is any conditions like xerostomia or excessive chewing, excessive habit of chewing, gums, they also cause problems with saliva production. Okay. Now, initially, whenever there is plaque formation, you see gram-positive cocci, and then gram-positive cocci requires oxygen-rich environment because they are aerobic bacteria and they can be seen only in supragingival plaque, whereas in subgingival plaque, you can see gram-negative rods. Now coming to erosion, abrasion, attrition, abfraction, and hypersensitivity. Erosion can be actually seen, just a second. Erosion can be actually seen when there is consumption of high sugar drinks like Coca-Cola. So you can see a layer gets eroded. Okay, and it can also occur in high consumption of citrus fruit juice. Abrasion happens mainly due to tooth brushing. When you use like hard toothbrush, then there can be a mechanical wear, that is nothing but abrasion. Attrition is occlusal wear due to functional contacts with opposing tooth. So let me use a pen. So what happens exactly in attrition is, so let me draw. So this is a tooth, this is a tooth, okay. Now, this person might have bruxism. At night, he might have a habit of clenching of teeth, due to which there will be a wear at the contact points. Okay, whereas abrasion is due to toothbrush and erosion is due to citrus fruits and lot of acidic food or fruit juices or carbonated drinks like Coca-Cola. Here you can see a layer is eroded, that is erosion, and then this is abrasion, mechanical where this happens due to using a wrong faulty toothbrush, and attrition is mainly because of bruxism, parafunctional habits. There will be loss of layer. Now coming to abfraction. Occlusion loading resulting in tooth flexure, mechanical microfractures, and tooth substance loss in the cervical area. Abfraction you see in the cervical area. It may look similar to erosion, but abfraction can be seen in cervical area. Hypersensitivity is due to exposure of dentinal tubules and root surfaces due to thermal changes. Okay. Following recession and removal of cementum by tooth brushing, dietary acids, if there is tooth decay, if there is caries, and if you just got a scaling done and you try to eat an ice cream, there'll be little sensitivity in the tooth. That is because of the exposure of dentinal tubules. So I hope you have understood today's class. And if you have any comments, you can leave it in the below and I'll get back. Thank you.